Hi, it's Christina Weng from Baylor College of Medicine. I'd like to welcome you to the TLDR, where we tackle the most topical issues in the retina space with leading experts in the field. It's my pleasure to welcome here today two of my colleagues and friends. First, Dr. Christina Flaxel, Professor of Ophthalmology and the Beulah Buck Arvison and Charles C. Arvison Professor of Macular Degeneration Research at the KCI Institute. And we also have Dr. Noam Rudnick, a surgical retina specialist at Retina Consultants in Hartford, Connecticut. They also happen to be two of the top recruiters for DRCR protocol AO, which is evaluating home OCT and wet AMD management, which is going to be our focus today. Welcome, Chris and Noam. Thanks so much for being here.
Thank you for inviting me.
Well, before we start, let me first take a moment to explain what inspired the birth of this series. Last year, I was shocked to learn that the average attention span has shrunk to just 47 seconds. So even though I encourage the audience to tune in for the entire conversation, we start every interview with the TLDR. So Noah, I'm going to ask you, what's the TLDR here?
Thanks, Christina. It's great to be here. Home OCT is a patient-operated device that allows physicians to monitor patients with wet AMD between office visits. It works in tandem with an artificial intelligence-based algorithm that detects intraretinal and subretinal fluid. Overall, home OCT has the potential to personalize treatment for wet AMD by potentially reducing the number of office visits and overall treatment burden.
That's a fantastic summary. So let's back up a little bit. Maybe let's set the stage a little bit more. Chris, most of us have had good success managing wet AMD with anti-VEGF injections on a treat and extend schedule. So why would home OCT even be necessary? I mean, what are the opportunities here for improvement?
That's a really great question. As we all know, our injections work really well, and it does. Most people are helped, but there are many barriers to this, and our patients are elderly. It's hard for them to get into the office. Transportation is a big issue. There are also many medical problems these patients have that make it difficult to get in. So if they could self-monitor at home, as Noam said, that would be great. Then we can then do personalized medicine, have them only come in when they need a treatment, rather than coming in often where we're just saying, you're great, we'll treat you today, and then we'll extend you. But maybe we could just extend a lot of people with actually not having to see them in the office.
Yeah, and I think that's particularly true with some of our longer durability agents that are just right around the corner. I'm going to ask you to extend just a little bit further on the home OCT device itself. Tell us a little bit about how it works, Chris.
So the home OCT device is actually great. It's very small, very compact, so patients can put it in a location that's good for them. It's easy to use. I've really not had patients fail on the testing unless they have really poor vision. So as long as they have reasonable vision, they're even my elderly patients are great with it. And I think that's the benefit of it. They can do their own OCTs at home. It then takes the information, runs it through this AI algorithm, and tells us if there's fluid. And it's very, very easy to use and very, very compatible with our elderly population.
Fantastic. And we'll dive into that a little bit deeper later on in this conversation. But I want to talk about Protocol AO from the DRCR, which is a randomized clinical trial. It's going to randomize 600 treatment-naive wet AMD eyes to either faricimab given on a home OCT-guided regimen versus faricimab given on a treat and extend regimen. And the co-primary outcomes are change in visual acuity and the number of injections at 2 years. Noam, if a benefit is seen with the home OCT guided arm, as you mentioned a few of them potentially in your TLDR, how do you foresee this potentially impacting the way that we manage wet AMD?
Yeah, it's a great question. As was alluded to, there's different treatment regimens that are typically used for wet AMD. We have fixed dosing, as needed dosing, and, treat and extend, which is the popular hybrid approach. While these strategies have been shown to have similar outcomes, there is some question from like 2-year CAT data, for instance, showing that potentially as needed treatment may have not as good vision outcomes as patients on scheduled treatment. But those were only being monitored on a monthly basis. So I think home OCT is exciting because it offers us the ability to do as needed treatment with much closer monitoring on a daily basis. And so I think we could end up catching disease recurrence much earlier. I think the big question is, how do vision outcomes compare to scheduled treatment regimens? And obviously that's what Protocol AO will tell us. If home OCT guided treatment is equivalent or superior, I think it could represent the new standard for managing wet AMD. Even if it turns out to be equivalent or inferior to treat and extend, there may still be a role for home OCT as a supplement to scheduled treatment regimens, as we see more durable treatments in development, such as tyrosine kinase implants, et cetera. We will need a way to monitor for disease recurrence between office visits, which may be as far apart as every 6 months or a year for treatment. So I think home OCT would be perfect for that. I think we'll get a lot of other interesting insights from Protocol AO, especially looking at a very sort of granular picture of how fluid dynamics change for patients with wet AMD. I think there's a lot more heterogeneity than we recognize in our AMD patients. And I think that's been shown in some of the preliminary studies with home OCT that have already been done. So it'll be interesting sort of seeing all that heterogeneity in really good detail. And then, of course, the other exciting thing with home OCT would be detecting new onset wet AMD in the fellow eye, for instance, right away. And so I think it will give us the capacity to diagnose that immediately and treat it and hopefully improve vision outcomes for patients.
Yeah, what I love about this study is that I think there is just such an incredible amount of learning that's going to happen regardless of the outcomes of it. There are just so many different nuanced areas, including fluid tolerance and the comparison to what most of us are doing in, our day-to-day practice with treat and extend. Great summary there, Noam. Thank you so much. I want to go back to Chris's point earlier about sort of the usability or feasibility of the device. That I remember initially when we started, I wondered whether my 70, 80, or 90-year-old patients would actually be able to operate this technology. And I very much agree with Chris that they have been able to use it very easily. I've been so impressed. Speaking from your personal interactions, Noam, not on behalf of the DRCR or the study, what have your patients' experiences been like using the home OCT?
Well, I think the patients overall really like it. They say it's easy to use and it doesn't take them more than, a minute or so each day. I think Nodal has also been extremely responsive in terms of addressing any device issues that have cropped up or replacing devices if needed. And overall, I really haven't heard any negative feedback from patients. I think when Protocol AO patients are randomized, they're all crossing their fingers. They end up in the home OCT group. And,
Yeah, totally.
for those that do, I don't think anyone's been disappointed.
Yeah. All right. So I guess we all share those similar experiences. Chris, I want to go back to you. You talked about the patient experience, but one of the questions I get a lot is about the new work stream that home OCT creates. And, both of you have mentioned the AI algorithm, which is very important to stress for the listener that it's the AI algorithm that's doing the heavy lifting in terms of assessing images for fluid. But it does still require someone to respond to fluid alerts, contact that patient, bring them in for a visit and possible treatment. I've spoken with you and your team and Anne, of course, a lot out at Casey. What's your experience been from the provider end in dealing with the home OCT and the alerts that may come along? Again, speaking from a personal perspective with your own patients.
Well, it's been pretty easy for me, but I have a great team. That's
You do.
one
You
thing
really
you do is you
do.
put good people around you, and Anne is awesome, and Anne gets the notifications when I do, and if I somehow miss them, like if I'll get three and I miss one of them, Anne's already on top of it getting them. So, and it's easy to interface with it. So I haven't had any problems logging on, looking at the photos and seeing that there's fluid. And then the patients all know that if they get a phone call, they're going to need to come back in. So they've been really good about it. I don't know in my daily office practice where I only have like one admin who does everything for me. I don't know how easy that's going to be, but in the study, it's been super easy.
Yeah, I think those are all questions that we're going to learn about as well from Protocol AO. And, we'll talk about some of the considerations when we potentially expand out home OCT in the future, which of course, a lot of that will hinge on some of the results that we see. Noam, I'm going to go back to you. The home OCT was FDA cleared in May of 2024, but widespread rollout will, like I said, likely hinge on establishing, first of all, the reimbursement landscape, as well as studies like AO. What are some of the challenges that you see, Noam, that will probably need to be addressed before we can begin using home OCT on a larger scale as a community?
Yeah, I think there's a few things that probably need to be addressed. So from a technical standpoint, I think one thing that needs to be figured out is the fluid threshold. So, One option is using a uniform fluid threshold for all patients, like we're doing in Protocol AO, but we may be able to even improve on that by using thresholds that are customized for each patient. So as a community, we'll need to sort of determine the best approach for setting those thresholds. As you alluded to on the financial side, home OCT will need to be covered by insurance. As of right now, my understanding is patients need to pay out of pocket if they wish to utilize the device outside of a clinical trial setting. More of our payers will need to reimburse physician time spent on reviewing home OCT data. And then lastly, in terms of our clinic flow, we will need to implement processes for getting patients in for urgent visits as soon as there is a fluid alert. And that may be a challenge given how busy our clinics already are, but I think it's certainly something that can be done.
Yeah, all great points. Well, lots of terrific discussion. Chris, where can viewers go to learn more about home OCT and Protocol AO?
I think they could look at Protocol AO on the DRCR net website. That's a site for patients as well and for physicians. There's Annette Lowenstein who did a lot of the initial work on OCT. So there's several papers of hers that are published, and she's got a lot of things online about her work with that. There's also recently a good editorial by Judy Kim and a few others that looked at the benefits versus the non-benefits of home OCT, like the cost and everything, as Noam just mentioned.
Fantastic. And we'll be sure to leave some of those links below so that the viewers can access them. Well, great to chat with you both about a topic that we're all very passionate about. And I also want to just take a moment to recognize the DRCR Retina Network, the JABE Center, and all of the participating sites and patients. It really does take a village with a major trial like this. And we couldn't be where we are without enthusiastic investigators like you both. Chris and Noam, really appreciate you joining me today.
Thanks, Christina.
Thanks a lot, Christina. Nice to see you all.
Nice to see you too. Well, we've just kicked off season 2 of the Retina TLDR, and we welcome your feedback. So please reach out with comments via the contact below. In the meantime, I'm your host, Christina Weng, and we'll catch you next time on the Retina TLDR.